Oncology in three would be medical oncology, surgical oncology, and radiation oncology. Medical and surgical oncology tend to be the most common, most known types of specialties when it comes to oncology. Radiation oncology is the treatment of malignant cells with X-ray treatments. That's our basis. We use IMRT or VMED techniques. These are different types of techniques we use to deliver our radiation. We also do intraoperative radiotherapy, which is application of the radiation seeds directly into the surgical cavity to be able to treat the patient while they're on the bed. We also sometimes do brachytherapy, which is insertion of gold seeds into wherever it is that we're targeting, so whether it's the prostate, whether it's a surgical cavity, lung, cervical cancer patients, endometrial cancer patients. So different modes of delivery treatment, but in one sentence, radiation oncology is the study and treatment of cancer using radiation beams in different forms.
And within the practice or department that you're working in, what are some of the common types of cancers that you do come across?
So technically I work for the entire department, which is 39 physicians, and that could mean I work in all site groups. Over the last 4 years, I've ended up working in lung, breast, GU, gynae, GI, eye, CNS, pediatric, endocrine, pituitary, and palliative clinic patients. But in a general week, I would end up seeing mostly breast and GU patients because, as we know, breast and prostate cancer patients tend to be the most common, in general population.
What do you like about working in radiation oncology? What do you enjoy?
I love working with all oncology patients. What I really like about radiation oncology is that each and every treatment plan is custom designed for the individual patient. I like being able to look at the entire individual and not just having one set of plan that we have for everybody. So for example, sometimes we have somebody on paper who looks like they've got comorbidities, everything from meningiomas to cardiac conditions to bone issues, but when you actually see the individual, they're upbeat and they want everything possible for their cancer care. And on the contrary, we have somebody who is probably really frail and needs a lot of our support in getting where they need to get to eventually. So I like being able to sit with each individual person, planning out a treatment plan which is right for them, to be able to eventually get to the point where we are curing all of our patients of cancer. It's a big upcoming thing right now. I know Princess Margaret's tagline is to come up with a cure for cancer in our lifetime. And I think everybody I work with is working extremely hard to get to that point, whether it's pathologists, radiologists, or med-oncs, surg-oncs, rad-oncs. And being able, and just being part of that team makes me feel like I'm doing something extremely valuable for the patients, and I'm giving back to the community that I've taken from all these years.
And what do you find challenging about radiation oncology?
Recently I had a situation where I had to give bad news to an individual, a young individual. I've been giving him one bad news after the other. First, a diagnosis of cancer, and then recurrence, which needed an extensive 14-hour surgery with bone grafts and skin grafts, followed by extensive chemoradiotherapy, made him very sick, and he was just starting to get better, and now I had to give him another piece of bad news about, another cancer that was picked up incidentally while we were doing workup for the first malignancy. And sometimes that becomes difficult when you have to break bad news. Patients are very resilient, and that's one thing I've learned about these cancer patients is that they will take everything you can throw their way. But sometimes being on the other side of things gets a little hard. I try to use it in a positive way in that I can help them to the best of my ability, whether it's just, calling them a week later to checking in and just seeing how you're doing, because that means a lot to them. Just knowing that their healthcare provider hasn't forgotten about them and